Set 2B. There are 6 potential exercises in Set 2B which emphasise strength. Begin by using a small weight, such as a 500 millilitre water bottle. The exercises can feel tiring and difficult. You may find your arm shakes. That is fine. However, use a weight that you can lift 5 times. Gradually aim to increase your repetitions to 10. Repeat twice more, i.e. 30 repetitions in total, if you want to work on muscle endurance. Remember to take a rest day if your muscles are sore. You cannot damage the surgery, but do not over-challenge the shoulder to the point of increased night pain or pain when you are resting. Set 2B, Exercise 1. Forward with a weight. Stand, ideally with your opposite leg to your operated arm forwards, as if you're taking a step. With your elbow bent, holding the weight, lift your hand up towards the ceiling, stretching up, straightening your elbow as your arm raises. Alternate your arms if you're able. Set 2B, Exercise 2. Out to the side with a weight. Holding a weight in your hands, bend your elbows and rotate your hands outwards. Lift your arms up, stretching up, and aim for your hands to meet overhead. Control the weight on the descent, keeping your palms to the ceiling, elbows bending. This exercise may be too painful and/or difficult for some people following surgery. Leave it if this is so for you. Set 2B, Exercise 3, Stoop rowing. Standing, holding on to something stable so you can lean forward safely, hold a weight in your hand on the operated side. Lean forwards with a straight back, allowing your arm to drop down. Squeeze your shoulder blades together and bring your elbow up or backwards in a rowing motion. Set 2B, Exercise 4. Arms overhead and off the wall. Find a wall or a back of a door. Raise your arms up in a V shape with your thumbs pointing behind you. Shrug your shoulder blades up, allowing your hands to slide up the wall, and then relax. Keep the elbows straight throughout. Once you have the feeling and strength in this movement, slide the arms up, but then lift your arm off the wall. Try not to lean back. Tuck your tummy in. If you find you are leaning back, your shoulder may be stiff, and so return to the forward movement exercise in Set 2A. Set 2B, Exercise 5. Outward rotation with a weight. Lying on your unoperated arm, put a towel between your chest and elbow. Bend your elbow and hold the weight in your hand. Keeping your body and elbow still, lift your hand up in the air towards the ceiling. Control the weight as you lower it down to the starting position. Set 2B, Exercise 6. Weight bearing. Kneel on your hands and knees. Slightly bend your elbows and push up through your chest. Rock some weight forwards gently onto your arms. Lift your unoperated arm up in front of you, keeping the rest of you still. If this is too difficult, take some weight back onto your knees until you can succeed. A further progression would be to lift your leg on your operated side out behind you, but try and keep the weight forwards as you do this. If you're unable to get on your hands and knees, stand and lean over to place your hands on a chair seat or a low table.